trying to give, I don't know, what would you call it, like an emergency, like I have a back pain today, what can you do right away that's real simple and easy to kind of take care of low back pain that's very common. So have you ever seen anybody with back pain?
Yes, way more than I care to admit. It's just a very common problem.
Well, what's their first question typically?
What do I need to do? I hurt my back. What do I need to do? Do I need to call the doctor? Do I need to go get an x-ray? Those are pretty much the most common questions that I get.
Well, I would say right off the bat, as far as the main advice to give for acute back pain that's very, very severe, is that most of the time you do not need to run to the ER or to the doctor. If you just have back pain, especially with no leg symptoms, it's very common. Even if it's a 10 out of 10, you can take care of yourself. And some simple advice that we're going to give you today should be able to do that to help you at least knock off the edge of the pain, make you feel like you didn't injure yourself for life. So what's the very first thing you would tell somebody if they had 10 out of 10 pain, they can't move, what should they do?
I always tell them to try ice, see if that helps calm down some of the pain. You can try an anti-inflammatory.
Well, why would you try ice?
Why would you try ice?
I hate ice. It makes me feel bad. It makes me tighten up. I don't like it. Why would I try ice?
The one thing it can do is it can kind of numb the area.
Okay.
A little bit.
Okay.
What about you?
Well, my biggest reason I like ice is because it's a natural anti-inflammatory. It's one of the few natural anti-inflammatories there are, so you don't have to necessarily have painkillers, pain medicine, steroid injection. Even the people that hate ice, usually if you do it one time, 10 minutes, ice pack right directly to the area. Usually you want to cover it with like a small towel. A good ice pack would be like a gel pack. You can get one on Amazon for $12. They're real cheap nowadays. Or if you do want to do the classic frozen peas or like crushed ice in a bag. So ice pack is the most important thing to do right off the bat when you have acute issues. And then going into what you said as far as the medication, what's usually your medication suggestions? Now these are suggestions, we're not your doctor, so these are suggestions that most people are going to get for most of their pain anyway.
I typically suggest something like Aleve, Advil, ibuprofen. Are there any others? Aspirin, Tylenol.
Yeah, they're all NSAIDs. They're all anti-inflammatories, right? And there's different versions of them, like you can get Excedrin, which is basically aspirin, Tylenol, and caffeine. So there's a lot of over-the-counter stuff. Usually I tell people, if you don't have a question about that, ask your pharmacist. Actually, your pharmacist is a free resource. They know exactly what to tell you, especially if you have other medication that you're using. So if you have any questions about the over-the-counter stuff, and not to kind of disparage your doctor, but most of the time you go to the doctor nowadays, that's all you're going to get anyway. You're only going to get naproxen, like ibuprofen, maybe at a higher dosage. So go ahead and take your over-the-counter stuff. Ask your pharmacist if you're really kind of not for sure about the dosage. Okay, so what's the last thing you would recommend somebody who has back pain and don't know what it is?
You want to rest, but not stay completely still.
Okay.
Is that where we're going with this?
Well, kind of. I would actually say the next step is that you need to call your physical therapist.
Yes.
Feel free to always use your physical therapist. You can call us, text us, email us at any time. I mean, I answered an email last night at 10 o'clock, which I try not to do anymore because I need to sleep. But we do have those. We can talk to anybody right off the bat and tell you what is going on. Just that reassurance that we are the experts in this issue should help give you the confidence that you need that you're not hurt. You may not even need therapy right away, but at least we can give you the advice to kind of get you taken care of right away. So.